We're expecting a big announcement from the government on the NHS because we know there is a big problem. And new data, analysed by our data and forensics team, can tell us just how big it is. This is the picture on the front line in accident and emergency centres. Now, patients going to A&E are supposed to wait no more than 4 hours. That's the target. There are 111 NHS trusts in England. From April 2021 to March 2022, not a single one met that 4-hour target. So what's going on here? You might assume that demand is up, that A&Es are being swamped with patients. Well, no. This chart shows the number of people going to an A&E is actually at its lowest since 2017, not including that pandemic years. And those numbers have been pretty steady over the years. But this is how long people are waiting for more than 4 hours. And the number waiting for more than 12 hours for the first time ever, that was nearly 1 million people. And you can see it's gone up quite sharply. So I think what you get from that, this isn't just a hangover from the pandemic. People's waiting times up there have been increasing over the years, even though the number of people going to A&E hasn't so much. Now, that is the big picture, but there are important differences depending on where you live. Now, again, no trust made their waiting time targets, but Sheffield Children's NHS Foundation Trust came closest. Nearly 95% of people were seen within 4 hours. Barking, Havering and Redbridge, on the other hand, in East London, performed the worst. Nearly two-thirds of people, 100,000 people out of 157,000, waited more than 4 hours to be seen. So geography makes a difference, but so does something like the time of day. And this is the percentage of people waiting for more than 4 hours, and it depends on when you show up to A&E. So you've got the start of the day here, in towards the midday, all the way through to the early hours. And what you can see from that is waiting times get worse pretty steadily as the day goes on. And that might be because people who attend A&E late at night are more likely to be in a serious condition which requires complex treatment. But if you wake up feeling ill, you might be better off rushing to A&E first thing in the morning over here rather than waiting around until lunchtime. Now, one last thing I want to take you through is this. It shows the people in the most deprived areas, this column here, they used A&E centres twice as much, 3 million people, as those in the least deprived areas. This is the richest area of the country. You can see 1.5 million people over there. So as inflation bites, as people become poorer, the cost of living crisis could become part of the NHS crisis too.